As Rapid City continues to debate implementing a mask mandate, one South Dakota town that's had one in effect for nearly 3 months now has numbers proving a mandate is working to slow the rate of coronavirus. In tonight's COVID-19 Beyond the Numbers, KELOLAND's Angela Kennecke shows you how the Brookings mask mandate has worked and what it means for both public health and the economy.
Like most mask mandates proposed in South Dakota cities, it didn't come without opposition.
I think it should be everyone's right, whether they wear one or not.
I just don't think that the city should be able to infringe on our rights and tell us what we can and can't do.
In the end, the Brookings City Council approved the mask mandate ordinance and extended it until the end of this month. Brookings City Councilor Nick Wendell knew everyone wouldn't follow it, but hoped most would.
But that we would start to build a culture in Brookings that really normalized wearing masks, in particular when you are in an indoor space, that it just became a part of our regular routine in the community.
Now, the number of COVID-19 cases is proving that masks, along with social distancing and good hand hygiene, can make a difference.
In the last week, we have the lowest rate since the beginning of the pandemic. We have the lowest rate.
SDSU epidemiologist BONNY SPECKER collects COVID-19 data for the city of Brookings. Out of the 10 counties with the most populated cities in South Dakota, Brookings County had the lowest rate of COVID-19 cases at the end of November, with 74 positive cases per 100,000 people.
You know, people say, well, you have this mask mandate, but you still have cases. But you have to realize the mask mandate's for the city of Brookings, the data's for the county of Brookings, and it's not like the city's isolated. You know, we have people coming in and out of the city all the time.
We have had peaks and valleys in terms of positive cases in Brookings County. COVID didn't go away here, but we certainly worked together to slow the spread, to lift some of that burden on healthcare workers.
And it may have saved some lives.
So if we can control the number of cases in a community, we can minimize the number of hospitalizations, and ultimately we can minimize the number of preventable COVID deaths.
Wendell says cooperation by the city, university, and Brookings School District, all implementing mask rules, have made it possible.
If students went home and they couldn't continue in-person learning this fall or spring, that would have a tremendous negative impact on our economy. If any of our manufacturing plants had to close, in particular for our hourly workforce, that could have a tremendous negative impact. And so we had not just a public health interest, but I think an economic interest to do what we could in Brookings to slow the spread.
While the Brookings mask mandate is set to expire at the end of December, Wendell says with a long winter ahead of us, Brookings should keep the ordinance in place because it's working. The Brookings City Council will look at another extension later this month.